Okay, this is Chapter 14, Lesson 14.2. Disorders of the lymphatic and immune systems. Immunodeficiency. So there's one form of immunodeficiency is acquired immunodeficiency syndrome, which is AIDS, AIDS. This destroys T helper cells and it makes the individual susceptible to opportunistic infections. And there's also malignancies that come along with that, such as the Kaposi sarcoma and wasting syndrome. There's many opportunistic infections that often affect individuals with AIDS, such as candidiasis, cryptococcus, cryptosporidiosis, cytomegalovirus, herpes simplex, histoplasmosis, Mycobacterium avium intracellular infection, pneumocystis, pneumonia, toxoplasmosis, and tuberculosis. There are drugs to treat acquired immunodeficiency syndrome. One is the reverse transcriptase inhibitors, RTIs. These inhibit viral enzyme called reverse transcriptase. Protease inhibitors inhibit the viral proteolytic enzyme. And a combination of the both is known as HAART, or highly active antiretroviral therapy. A hypersensitivity, this is an allergy which is an abnormal sensitivity that's acquired by exposure to an antigen. So this can range all the way from something pretty mild as allergic rhinitis or hay fever to something very severe such as anaphylaxis. Other allergies are atopic dermatitis, asthma, and urticaria, which is hives. Tumors. So the most common is lymphomas. These are malignant tumors of the lymph nodes and lymph tissue. You have Hodgkin lymphoma, which involves the Reed-Sternberg cell, and then non-Hodgkin lymphoma, which is either a follicular lymphoma or a large cell lymphoma. Multiple myeloma is a malignant tumor of bone marrow cells. Thymoma is a tumor of the thymus gland. This is often associated with myasthenia gravis. Patients may have other autoimmune disorders such as lupus, erythematosus, and rheumatoid arthritis. Here's the staging of Hodgkin lymphoma. Stage 1 is the involvement of a single lymph node or a single group of nodes, such as this one right here near the thymus, the mediastinal. Stage 2 is involvement of two or more sites on the same side of the diaphragm. That one often involves the mediastinum. Stage 3 is when the disease is on both sides of the diaphragm, so above and below it, and this may include the spleen or a localized extranodal disease. And stage 4 is when it's widespread extralymphatic involvement, so it's including the liver, the bone marrow, lung, or skin. What is a malignant condition that's often associated with AIDS? Does anybody remember? That is C, the Kaposi sarcoma. Laboratory tests that are often run on the lymph system is a CD4 plus cell count. This measures the number of the helper T cells in the bloodstream with patients with AIDS. So this is a good kind of marker for patients with AIDS. When their T cells are extremely low, they will often go into isolation to protect themselves from other acquired diseases and viruses. The ELISA test detects anti-HIV antibodies, and then the Western blot is given as follow-up. Immunoelectrophoresis. This separates the immunoglobulins, which is the IgG, IgM, IgE, IgA, and IgD. And then a viral load test measures the amount of AIDS virus or HIV in the bloodstream. A clinical procedure that's often performed on the lymph is a CT scan or computed tomography. This is X-ray imaging that produces cross-sectional and then other views of anatomic structures. These X-ray views show abnormalities of lymphoid organs such as lymph nodes, spleen, and thymus gland. So our abbreviations are AIDS or AIDS, CD4 plus cell, which is the helper cell, CD8 plus cell, the cytotoxic cell, CMV, cytomegalovirus, crypto or cryptococcus, ELISA, which is the enzyme-linked immunosorbent assay, GCSF, granulocyte colony stimulating factor, GM-CSF, granulocyte macrophage colony stimulating factor, HAART, highly active antiretroviral therapy, histo or histoplasmosis, HIV, which is the human immunodeficiency virus, HSV, which is herpes simplex virus, IgA, D, E, G, and M are the immunoglobulins, IL-38 all the way to IL-5 are the interleukins, KS is Kaposi sarcoma, MAI is Mycobacterium avium intracellular complex. The MOAB is the monoclonal antibody. NHL is non-Hodgkin lymphoma. PCP, pneumocystis pneumonia. PI or protease inhibitor. RTI, reverse transcriptase inhibitor. SCID, severe combined immunodeficiency disease. Treg are the regulatory T cells or suppressor T cells, and toxo is toxoplasmosis. Our combining forms review are axilo, cervico, immuno, inguino, lympho, lymphadenal. There they are again. Spleno, thymo, and toxo. Suffixes are cytosis, edema, globulin, megaly, oid, and pathy. Penia, phylaxis, poiesis, stitial, suppression. Our prefixes are ana, auto, hyper, inter, retro. And what is the name of the fluid that lies between cells throughout the body? It is C, interstitial. What's the malignant tumor of the lymph nodes and spleen marked by the presence of Reed-Sternberg cells in lymph nodes? That is the Hodgkin lymphoma. Reed-Sternberg means Hodgkin. Lymphoma is the tumor. And that's the end of lesson 14.2.